Hi, I'm Dr. Baruch Williams, Dr. B, pediatric neuropsychologist.
And I'm Catherine Mukes, licensed professional counselor.
And welcome to Let's Talk. Today we're going to be talking about therapy with teenagers, or even assessments with teenagers or adolescents. One thing that has come up for me oftentimes when I recommend that an adolescent or teen seek psychotherapeutic intervention, I'll have teens that will ask me, that's okay, but are they going to tell my parents everything that I say? Because if that's the case, then that's a no. Exactly. So we want to talk about what it's like working with a teenager or an adolescent, and some of the limits of confidentiality, meaning what is confidential for the teen, and you know, what areas aren't confidential areas, and that's information that could be shared with their parents.
Absolutely. So I guess the first thing is, you know, whenever we're entering into a new therapeutic relationship, whether the client be an adult or a teenager or even a young kid, is to just explain to them what confidentiality is. And in a nutshell, confidentiality basically means whatever said between the therapist and the client in this sacred space stays in this sacred space, with some exceptions. And those exceptions include evidence or suspicion of child abuse, elder abuse, suicidal intent, or homicidal intent. So those are kind of the big things. Now there's other times when I may tell your business, right? So like if you decide to sue me for whatever reason, I have to defend myself. If maybe sometimes for insurance purposes, so maybe if you're using a third-party payer, which basically is your insurance company, to pay for services, oftentimes there's certain information, and usually we try to release minimal information where that's concerned. Other times that it might come up where confidentiality is breached is if there's issues of being subpoenaed by a judge to release those records. And so there may be some situations where we give that information, but by and large, whatever happens in that therapeutic space stays in that therapeutic space.
Right.
Yeah. However,
you know, it's a special circumstance with teenagers. Absolutely. Because on one hand, we want to establish a connection, establish this level of trust with the teenager, and beyond the circumstances that were just explained, you know, there are some things that teenagers will discuss with their friends, or you know, other individuals, their therapists, hopefully, that they may not be willing to, or they may not know how to share with their parents.
Yeah, and some of those things, you know, are just one of the fears of a lot of kids with being just totally honest with their parents, is there's this fear of being in trouble, that there's going to be some major consequence if their parent finds out certain things. One of the other issues that some teenagers have is that their parents just don't understand. So even if you did tell, they wouldn't get it. They just don't get it. They don't get me. They don't understand me. And so when thinking about, one of the things that I like to explain to my teenagers is that what we say stays in here, unless I think that there's a serious safety issue present. And what I like to do is help empower you to share that with your parent versus having me, because I don't want to rat you out. But if there's certain things that are important, so for example, if you're a teenage girl and you come into my office and your parent brings you in, and some kind of way you tell me you're pregnant but you haven't told your parent, that's going to be a discussion we're going to have intently about you being able to break that to your parents.
Right.
I'm not going to run out and go, hey, you need to know this. But we're definitely going to be moving into those areas, because those are pretty serious things that our parents do need to know. And when we're talking about teenagers, we're talking about anyone under the age of 18.
Right, right.
Because at 18, it's different because at 18 you're legally an adult.
Right. And you know what? I think that what I hear you saying is that you're going to provide, in those situations, you're going to provide the support so that that information can be shared, you know, with the parents when absolutely necessary. Another thing that I think about is not only talking about the limits of confidentiality that we discussed at the top of this session, but just sitting with parents and the teenager at the beginning of therapy to talk about situations that may occur outside of those limits, and how you would, you know, manage that, just so everyone is on the same page from the beginning, so parents don't have to come in on session 4 and say, okay, give me the rundown of everything. They're already clear that that's, you know, not the way that therapy will proceed from the beginning.
Yeah, and there may be some things, so let's say, for example, we're dealing not just with the teenage issue, maybe there's some parent-child conflict that we're dealing with, and so at that point we're basically doing therapy for the relationship. And so that means we're going to take some of that information, and we may have to meet with the parents separately and say, okay, not that we're going to tell them all the things that we've talked about with the kid, but being able to say, hey, these are maybe some kind of general concerns or some things maybe that I've even witnessed, and so let's see how we can work on those things so that we can bridge this gap so that you and this child can have the relationship that you guys really want with one another.
And another thinking about, you know, having to, times when you do have to bring the parent in, is thinking about particularly young children who are learning strategies for managing anxiety or managing symptoms of depression, and that they may learn these strategies in session, but they may need some help from their parents to cue them, you know, to implement these strategies at home. And in those cases, it's important to have the parents on board.
And then I think that's a little bit different than telling the child's business, because one of the concerns for teenagers and even some younger adolescents is that you're going to basically tell all my secrets. And so really when it comes to things like that, it's really mom and dad need to know what skills we're working on and what you need to be doing. And one of the things that I like to do with kids in that way is part of their homework might be to go teach this to your mom and your dad.
I like that.
So now I kind of pull myself out of the way of being the tattletale and giving them the opportunity to be able to share as much as they want with their parents about what's going on in their therapy, particularly what they're learning. Because for some people, right, one of the things that I've experienced is that most of the parents who bring their teenagers in particular into therapy, they don't want to know. They just want to see their child get better. So oftentimes it's not so much of, you know, I'm going to send them to you and then I'm going to call you so you can tell me what they said. I've never had that experience. Now, and I'm not saying that it may not happen or that some parents might not be itching to know, but there's this understanding, and that there's this idea, because even some parents go, you know what, even if they don't want to talk to me about it, and I get that because it can be hard to talk to your parent about challenging things sometimes, I want to know that they're talking to somebody. Well, see, my thoughts about that is respecting the adolescent and their privacy, but I also sometimes, you know, have asked parents, well, what are they working on in therapy? And the parents are not certain about, you know, if they're in there being silent, if they're in there talking about their favorite video games, are they, you know, actually addressing the concerns that are at hand. So these are other reasons. To some extent, I think the parents need to have like a general idea of what. And part of that goes into their involvement from the outset. And so it just really kind of depends on kind of where you're going. So for example, if you have a child who's having behavioral problems in school, right, I'm going to need to check in with the parent and say, hey, so we've been working on some things for the past few weeks. Have the phone calls stopped, or have they reduced? What are we seeing that's different? And so it's not necessarily about going in and breaking the child's trust, but also measuring whether or not, because we can take the child's word for it. But if the person who's getting called is the parent is going to know if the school is calling them every day or not.
That's true.
And so really being able to understand that it is a collaborative team effort. One of the things that I often ask in a first session, because usually if I have a teen, even if it's a teenager, 17, 16-year-old, and their parent or parents, is what is it that they're hoping? Everybody, what is it that they're hoping to get out of this process? And oftentimes it's very different from the parent to the kid.
Wow.
For a lot of the kids, they don't even know.
Yeah, they're just there.
They're just there.
Yeah.
And some of them want to be there, but they still don't know where it is that they're trying, what they're trying to do. With parents, it's often something very behavioral. Yeah. The parents are saying, I need for them to, you know, be finishing their homework. I need for their grades to increase. I need for them to not get suspended. It's usually some very specific behavioral changes that they want to see. And so what we do is try to tap into the behavioral pieces, but also the emotional pieces that may be driving some of the behavioral pieces. And so oftentimes for the parents, they don't necessarily care what that underlying piece. I'm not saying that they don't care. I'm saying as far as the therapeutic process is concerned, they may not care as much as they do seeing the outcomes of, okay, you know what, I've been noticing that they're waking up without, you know, cussing everybody out, and that, you know, that's awesome, and we're happy that that's happening for them.
Yeah. So, any other kind of thoughts about confidentiality with teens and adolescents?
Yeah. So I think those are just really kind of the big ones, you know, just the overall understanding of confidentiality as a whole, for the kids understanding, and the parents understanding that that space is sacred and it's a safe space, and we're going to do our best to maintain the confidentiality within the confines of making sure that the adolescent is safe and that they're doing okay. We also want to have collaboration as much as possible. We know that the teenagers and the parents are the experts on their family.
That's true.
And so being able to have that input from all of those involved who need to be involved in that process can definitely be very helpful in meeting the goals.
Absolutely. Well, we hope you have enjoyed listening to us discuss the limits of confidentiality with teens and adolescents. If you have any, questions about confidentiality and what that looks like, or any concerns about it, just leave us a comment. We'd be happy to respond to you. Please remember always to like our videos and share them with someone that you love.
Absolutely.
Until next time. Bye.